There are several conditions that can cause cervical radiculopathy. Degenerative disc disease can cause radiculopathy as one or more spinal discs thin and the space between the vertebrae collapses, putting pressure on the surrounding nerves. A herniated disc can cause cervical radiculopathy if disc material leaks out and compresses or irritates a nearby nerve root. Cervical spinal stenosis can cause radiculopathy if the facet joints in the back of the neck tighten and compress the nerve roots as they pass through the foramina. Lower back strain is acute pain caused by damage to the muscles and ligaments of the back. It is often referred to as a pulled muscle. The back is supported by a large, complex group of muscles that hold up the spine, including the extensor, flexor, and oblique muscles. The soft tissues surrounding the spine, known as spondylolisthesis. Isthmic spondylolisthesis most commonly occurs at the lowest level of the lumbar spine, the L5-S1 segment. Spondylolisthesis is graded on a scale from 1 to 4, measuring how far one vertebra has slipped forward on another. Isthmic spondylolisthesis does not always cause immediate symptoms of pain. When it does, it usually manifests as a deep ache in the lower back. Pain from isthmic spondylolisthesis tends to be worse when standing or walking, or during activities that involve bending backward. There may be tightness in the hamstrings. Sometimes, the disc space between the two vertebrae can wear out. The resulting compression of nerve roots leads to radiating pain, numbness, or weakness in the legs. Isthmic spondylolisthesis is a fairly common condition among young athletes. Symptoms can differ depending on the location of the affected nerve. Nerve root irritation at the C6 level can cause radiculopathy symptoms in the biceps, the wrist, the thumb, and the index finger. Compression or irritation at the C7 level affects the base of the neck, the triceps, and the middle finger. Nerve root irritation at the C8 level impacts the fourth and fifth fingers and can impair the ability to grasp or grip with the hand and fingers. Neck movements such as turning or nodding the head or leaning the head back can further aggravate cervical radiculopathy symptoms. Symptoms of piriformis syndrome include tenderness and pain in the buttock area, accompanied by sciatica-like pain, numbness, and weakness that runs down the back of the thigh, calf, and foot. Pain from piriformis syndrome is often worse when walking upstairs, after sitting, or while walking or running. Piriformis syndrome is often confused with other conditions, especially lumbar spine conditions. Attaining a proper diagnosis of piriformis syndrome is important when considering treatment for low back and leg pain.